so let's just start off. Why you decided to undergo bariatric surgery? It's a big operation.
It is. It is. It wasn't an easy decision, and I didn't make it like in an instant. It took me several years before I decided that that's what I would do. And that pathway was kind of interesting because when they first started doing the bariatric surgeries in Pittsburgh, the only two options that you had were the full bypass or you had the band. And so I wasn't particularly thrilled about either of those, but at one point I was willing to consider the band and went through the whole preliminary process, the 6 months, this kind of stuff. They called me with a surgery date and they said, oh, we got a surgery date. And I was like, on second thought, I don't think I really want to do this. But the reason was because the nerd that I am, I have been researching and interviewing and talking to people who had the band. They did not have a significant amount of weight loss, and I'm like, wow, I did that on my own, so why would I do surgery? And at that time, I wasn't interested in the full bypass. But the reason that I wasn't interested was because of my previous PCP had type 2. He was very significantly overweight, and the last visit that I had with him, he said that he was going to do the full bypass. And so we had a conversation about it. I said, that's great. And I said, I hope everything goes well. And the last words he said to me was, I'll let you know how it goes. About 4 to 6 weeks after he had that surgery, he passed away. And the physician that I was working with at the time knew him personally, and he said that he'd had complications from the surgery. So all of this was in the back of my mind. And so as I got to know my new physician, I had never shared that with her, but we built a relationship over time. And no matter what I was doing to lose weight, she was okay with it. She's like, all right, I'm going to work with you no matter what. And so I was starting weight loss programs at my church. I was doing stuff in the community. I'm raising awareness about obesity, and everybody in the program at my church was losing weight except me. And I'm like, okay, this isn't right. Like, I'm doing all the things, and I was seeing the weights because I was the health minister at my church, and so I'm like, there's something wrong with this picture, like what is happening? So I would tell my physician this because at the time I was developing all of these comorbidities, and she was getting concerned about it. And so after several years, she finally sat me down one time and she said, listen to me. She goes, this is not your fault, and this is bigger than you. And it kind of like stopped me because I'm like, well, wait, all the things in my head were telling me I'm a nurse. Like, I should be able to do this. And everybody keeps saying, if you just exercise more and you eat less, that this will work. And she's like, that's not how this works. And so she said, listen, I'm begging you at this point, will you please see my friend who happens to be a bariatric surgeon? She's done a lot of my patients, and by that point, they were doing the sleeve, they were doing all the things. And she said, a lot of my patients have gone, they've got great success. And the other thing that was very significant to me at the time that she said, Michelle, you're a perfect candidate for the surgery. And the reason is because you're doing all the things already. You're working out, you're trying to change your lifestyle. I've watched you. Over these years, I've watched you do all of the things. And she's like, you need this as a potential tool. Go talk to her. So I did. Started going through the process. It still took me about 1.5 years before I was finally ready to pull the trigger. But I got peace. I felt like I had a lot of support, and I pulled the trigger. And it was one of the best health decisions that I've ever made. I've kept off most of that weight. The numbers that Amy just shared with you are pretty accurate. And I've recently had a breast reduction, and for whatever reason, I was telling Amy, I think I have some inflammatory response after each of these surgeries anytime. So I've had a paniculectomy, the same thing happened. I gained 10 pounds. Like literally the next day I'll weigh 10 pounds. And so, but then it's hard to come off. So with this last go round, when I well, actually, before the breast reduction surgery, we switched to Mounjaro because of the shortages. You know, I was like, okay, welcome to pharmaceutical Hunger Games, and this is what we're doing now. So my provider said, well, let's try the Mounjaro. So we started and did the titrations and nothing. And I'm like, really? Like, are you serious? Like, I mean, I'm talking no response. And so I said to her, hey, maybe we should just go back to the semaglutide. My pharmacist says it's available. Maybe she says, let's stay with it. Let's try to increase the dose. So 2 weeks ago, I think my 3rd dose is due today. 2 weeks ago, we did the 10 milligrams, and the scale has now started to move again. So, you know, I love sharing my story because, especially in rooms like this, because I think that it speaks to, A, it is a disease for real, that you can be doing all of the things and still you're not getting the result that traditional diet culture tells you you should get, right? And that also the chronicity of it, the fact that, you know, I had weight loss surgery 7 years ago. Yes, I've kept it off, and all the wonderful things that have happened in my life as a result of that and being able to keep it off are great. But even now, I'm still working with my provider. We're still playing around with, you know, medication dosages, and I've just accepted that that's probably what it will be until I leave this earth, and that's okay. I'm grateful that we have tools, but I think that it's important for people to know, and especially other healthcare providers to know, is that one size will never fit all for any of the folks that you see in your offices. I don't care how much research we do, I don't care how much documentation we have, it will never be one size fits all for anybody who comes into your office. When your patients come to you and they tell you what I'm saying to you, believe them. You know, because most people who live with the disease of obesity, we have done all of the things. It's not revelation for you to say, well, did you go to the gym? We've probably done all of those things. Most people who roll in your office, by the time they get to you, they've done all the things. They're looking for real answers and solutions, and for you to work with them and see them as an individual, considering all of the aspects of their lives. Because I'll tell you, it's interesting to me because I was actually going through a very, very serious marital crisis when I had weight loss surgery. And I did that because I had already been working on myself. It was the one thing I could control. I could control myself. So I think that it's a testament to, if you are doing the head work, and that's what I emphasize to other people, like, what do you do? I'm like, if you're not ready to do this, you're not ready for weight loss surgery. Okay, because that's a sacrifice that you've got to be willing to make from a psychological, spiritual, physical standpoint. If you're not ready to do that, that might not be the place to go just yet. So I think that it's important for you to look at all of the things when you're looking at the social determinants of health. All of those things matter when you're treating someone, not just for obesity, but I think any other chronic disease, but you have to look at the total person. And people deserve comprehensive, compassionate care. Check your own implicit biases at the door. We all have them, all of us. I thought that, I think you showed the picture in your earlier talk of the woman who had lost all the weight. But if you didn't know that, and that person walked into your office, I still have a little anxiety when I see a new doctor, because I think, oh God, did they read the chart? They're gonna look at me and be like, oh, Shelby thought about losing some weight, and then I'm gonna have to punch them, and you know. But anyway, no, but my point is that always have a fresh, new lens of compassion every time you see somebody, and come with them with your curiosity. Come with them with your affirmation. Come to them with collaborative solutions, because they're at the center of what it is. And so you might have all the science, and you might know, I think this is going to work. But that person sitting before you probably kissed a lot of healthcare frogs before they got to you. All right? They're probably not trusting, right? They might look like me, and there's not a lot of providers who look like me, and so that becomes an issue too, right? So you've got to be willing to come all the time when you see someone, no matter what the issue is, come with curiosity and all that compassion that we all agreed to when we decided that we were going to take care of people.
I want to shop. Oh, that's not working. I'm just going to recapitulate. No, we'll just share a couple of things. One is that Michelle is telling you that you need to trust your patient. If they're saying they have been working on diet, physical activity, and a whole host of other things, they are. You know, they're saying that they're eating, you know, I'm sure you've heard this, they're eating a lot less. They are. They are. It may be more than meets their metabolic needs, but trust me, they are. If you remember from what I said earlier, once you're in a weight-reduced state, you can consume far fewer calories. You become more metabolically efficient. So believe them, they are. And they're, you know, working really hard. This is a job, you know, and it's not, and I'll analogize this to type 1 diabetes, okay? You're always thinking about what you're going to eat, how much you're going to eat, maybe not in this setting, how it's going to affect your blood sugar, you know, what physical activity does or doesn't do. It, you know, it is at some points in a week or a month, all consuming. So let's remember that. Many of us don't have this second job. All right, with that, we're preaching, I hope, to the choir. Talk a little bit more about how really difficult it is, or has it become less effortful, and I'm not trying to put words in your mouth, to maintain your reduced weight.
No, it's not easy. I've just accepted that it's just not easy, that you just have to continue to do all of the things. So I have the privilege of having access to all of the tools. I have a trainer. I meet with him once a week, and then I show up to the gym about 3 or 4 times a week when he's not there. So that continues. I still work with a dietitian from time to time, just to make sure that there's nothing else that I can be tweaking or doing or what have you. You know, I think that you have to get to the place that you realize that you're living with a chronic disease, and so that just means that there's certain things that are better for you than maybe your sister or your friend or whatever, just because you're an individual. You know, someone else might be able to go to, like, I mean, not that anybody should, but they might be able to go to McDonald's a couple times a week and nothing really impact them in terms of their weight. I can't do that. You know, so I know what foods at what amounts work the best for me and how to do that. But no, I don't think it's even about it being easier. I think that I'm just more informed and I'm more empowered with knowing what works for me. But, you know, are there times when I wake up and be like, dang, I don't really, like, why do I have to think about this, you know? There's not mornings when I wake up and go like, oh, wow, I gotta go see Clay today. Clay's my trainer. But I get up and I go because, one, I feel better. And one of my whys is that, you know, my mother died of a massive heart attack suddenly at the age of 71. So, like, I'm hoping for more than 10 more years of my life. So that was another motivation. And I think I was involved in a conversation with someone. I think it was in Angela's group earlier, and someone was talking about their patient. And one of the things that came to mind when we were in that session is that you need to make sure that you try to identify your patient's why. Because if you can lock them in on their why, right, that's the internal motivator. So my why is that I don't want to die at 71. I have a beautiful 4-year-old grandson. I want to see him grow up. I have, you know, of 3 children, 2 of them who do not have children. I want to see that. I want to see them get married. I want to be able to move, and I want people to 10 years from now think that I'm still 61. Like you guys didn't think I was 61 today. So, so all of those things, yeah, I do have I'm a little bit of the diva, and I have a little bit of vanity, but anyway. So I just think that if you can help people or get them to the people who can help them work on the why, that's more of a motivator than the external shame and blame that we're often faced with when we live with this disease. So I think that, that's what keeps me going. But no, it's not easier. It's just that I think I'm in a frame of mind that I've learned how to manage.
And how often are you checking in with your physician?
So I see my bariatric physician every 6 months. If there's times when I'm feeling a little bit like, oh, we're off a bit, we'll see each other every 3 months just to check in and make sure that, I've got everything that I need. And then I get my regular checkups and things with my PCP, and my PCP and my bariatric person also, they communicate with each other. So it's ongoing. I've never, in fact, I really think that my bariatric, she's a physician's assistant, she's like, are you good? Do you want Dr. Miller to manage this? I'm like, no, I need to have everybody on the team. I need everybody. So, but I think it speaks to the fact that when you find the team and you feel comfortable in the support, you know that you kind of need to at least have access.
So, you can tell us about your other health consequences and maybe some of which went away. Whether or not you were able to reduce other medications. And then lastly, I want you to speak more about any changes in the relationships as a result of having lost weight.
So as far as the medications go, I was on 2 blood pressure medications prior to weight loss surgery, and they were like pretty high doses. And hypertension does run in my family, but I've also kind of made the connection too, which I didn't connect those dots, but my blood pressure became an issue when I was pregnant with my last son, and I developed preeclampsia, and my blood pressures were through the roof. It was crazy. So after that, I wasn't on blood pressure medicine, but it continued to creep up. So as that happened, I was on 2 medications, and they were pretty high doses. Post weight loss surgery, I was off of all of them. I was off of everything, like diabetic medication, I was off of blood pressure medicine, all of the things. But my blood pressure slowly started to creep up a little bit. So I still take Divan, but it's half the dose of what I used to take. And then the sleep apnea has improved greatly. My pulmonologist is kind of sitting on the fence about, he wants me to get a little more sleep. I'm still struggling with sleep. So if I get a little more sleep, I think he might pull the CPAP. So that has greatly improved. The bursitis, I haven't had about a bursitis, maybe once since weight loss surgery. And my overall osteo health is better. However, and this is a story with my right knee. I will have to do a knee replacement for the right knee, but I think it speaks more to, I had, in one of my many attempts to lose weight, I was working with a trainer and had me doing squats, and I was at one of my heaviest, and tore meniscus. And this is a great example of weight bias in healthcare you guys need to be aware of. When that happened, I had terrible knee pain, and I love to dance, and I kept telling the doctor, I'm like, I can't dance, like, this is like something is wrong. So I saw probably 3 to 5 orthopedic surgeons, all of which who said, you just need to exercise and lose some weight. And one said, lose 50 pounds and come back and see me in a month. Right, that part. exactly, right. So of course I walked out, I was in tears, I was annihilated, blah, blah, blah. So finally, another doctor of mine, I told him what was going on, and he says, call this person, one of these two guys, they're my friends, call. I went to one, he said, this is ridiculous, this should have been fixed 6 months ago. But all those previous surgeons could only see my weight. So anyway, as a result of that, I think the arthritis has set in, and we're gonna handle that, but anyway. I'm trying to think, my cholesterol, I don't take cholesterol medicine anymore. My GERD is gone. I mean, all the things. Like, I'm like probably the healthiest now at 61 than I was in my like 40s, 50s, yeah, so.
And then what about the relationships?
Yeah, so relationship-wise, you know, I'm a pretty gregarious person, so I feel like my inner circle never judged me in a way that I felt uncomfortable. I think, though, that my friends who know me well, they would say that I'm even more like confident, and I'm going, I thought that could be dangerous, I don't know, because I'm really not, I'm naturally an extroverted person, but I think that from a relational standpoint with myself, Amy, I think I just feel so much more like alive. I feel like so much more like zest for life, and the fact that, you know, now I can get on the ground with my grandson, and 85 pounds ago, I wouldn't have done that because I'd have been afraid that I couldn't get up. But, you know, this is a great story. This is a recent story. In Pittsburgh, there's Kennywood Park, so it's an amusement park. And so I had not been there since I had weight loss surgery until 2 weeks ago. And we were watching our grandson. And so I said, we should go to Kennywood. And we went to Kennywood, and I was able to ride in the Kittyland rides with him. So that was just like, oh my God, like I can't even put words to what that felt like. So, you know, so I think that those kinds of things, and having hope that I will live beyond 71, that I'll get to see him grow up and hopefully him have some cousins. And, you know, I mean, yeah, it's a lot. It's a lot of joy about being at this stage of this.
So if I may, because it seems all positive, but we do understand that there are individuals who undergo weight loss surgery or change their diet, physical activity patterns, or take medication to help them reduce their weight, and they lose friends, or their marriage becomes strange, or they're looking at themselves in the mirror and they just do not feel comfortable seeing themselves as this, what they perceive as a different person. Do you have any experience with that?
So on that note, I would say that it's more about the cognitive dissonance that you experience between what you see in the mirror and what other people are seeing. And I can tell you a kind of a funny story about that. Probably, I may have been a year or so into my weight loss, maybe not even that long, but I needed new pantyhose. And so I was accustomed to going to one particular store and buying, because they had my size, and buying a particular pair of pantyhose. And so the girl that my son was dating at the time, we worked together, and so I said, well, come on, I'm going to go to the store, I need to get pantyhose. And so I go over to the regular size. Now, mind you, I have now probably lost 65, 70 pounds at this point. And so I went, and I was going to get the regular size that I purchased. And she says to me, did you look at the size on those? And I said, yeah, this is the size I always wear. And she goes, no. She goes, and I said, what do you mean? And she goes, you're not that size anymore. And I said, sure. I said, you know, they're going to be too tight. And she goes, she takes the package out of my hand, she flips over where it has the weight and the height, and she goes, I want you to read this. And I was like, oh. And she goes, you don't weigh that anymore. These are gonna look like elephant hose on you. Right? And so it was like, oh my gosh. And I will also say that with weight loss surgery, and that you're not really prepared. I don't know if anybody can really prepare you for the skin, because there's a lot of skin. And I used to joke before it happened to me, and I would say, oh my gosh, I hope I don't look like a Shar-Pei, you know, those little dogs with all the, you know. And I said, and I'm like, oh God, I look like a Shar-Pei. So, you know, so really trying to manage all of that body image stuff has been, and I continue to manage that. And like I said, I've had a breast reduction. That's my latest. I've had some skin removed from my arms. I had the paniculectomy. I still think about other weight loss surgery, but I'm trying to control myself. Not weight loss surgery, but skin removal surgery. Yeah. So so I think that there is a lag time between you accepting the new you and what that means and what you look like. Versus what you really see. Yeah. So that's a great question. And I have worked with people who have a really difficult time around their new sense of self. Most have been that they're more outgoing, but a lot of people really highlight that they feel like people treat them differently. Like that they're more visible, that they're more, you know, accepted. Thank goodness I can say, I'm not saying I wasn't teased, especially when I was younger, I was, but fortunately in my adult life, in my professional life, I didn't feel that. So, and I don't know if it's just because I have been very open about, I wanted to be able to tell my own story, so I don't know if that's it, but yeah, definitely. I do know people who struggle.
And as you know, there is a small but vocal community about, you know, we as providers are contributing to eating disorders by helping our patients lose weight, talking to them about their weight, talking to them about losing weight, that we're all in it with pharma, no offense, Lloyd. You know, to sell more drugs, have more surgery. How do you speak to that?
Yeah, well, you know, I'm very vocal on social media about things and do a lot of these kind of events. Here's my thing. Like I said, we'll go back to what I said earlier, that everybody's an individual. And so I advocate for all the tools in the toolbox to be available to people who are living with the disease of obesity, right? And I feel like, you know, I was doing all the traditional things and did not have any type of, and didn't have the results that I desired. So I beg to differ that, you know, everybody's out to just make money. Yes, do I think that pharma should lower their price? I do. Do I think that we need to do more advocacy around the policies that are preventing people from being able to access the meds? I do. I think there's an intersection between all of that, and I'm all about advocating for it. But I think that that mindset still speaks to how much work we still have to do around educating the public about what this is and what this isn't, and that it's not about, because I mean, some people may take the drug and not have the results that they want. You know, as you can see, I'm not wasting away to nothing. That's not my story. So I'm very grateful to be able to have access to these things, and my advocacy is about saying everyone who wants to use them should have access to them, because you don't know what is going to work for you. You don't know what combination of the tools they're going to work. So I feel like physicians should be empowered actually to be able to help collaboratively patients decide what is going to work for them, give them a shot at it. So I don't think, you know, most of the things I feel like that we talk about in healthcare and other issues, I think people have a tendency to want to polarize everybody, right? It's like, oh, you take medicine, or you had surgery, that's the easy way out. And I'm like, well, how about it's not either or? How about it's and? How about it's just and? Like, maybe you need to have medication and a trainer. How about you need to have a trainer and a nutritionist? How about you need a good obesity medicine specialist on your team, and you need a psychologist to help you deal with the head stuff? It's not either or, it's and.
I think that sums it up. Thank you very beautifully and eloquently. Any last words that you would like to tell this audience of, newly minted fellows leaving, going into practice, what they should do or not do?
First off, I think it's awesome that you all are here and that you have this interest in obesity medicine and looking at the total person. You are very much needed in this space. Always honor your first commitment to honoring and validating patients and treating them with the highest level of respect, compassion, and esteem, and bringing your knowledge to help them to live the lives that they really want to live. So all people just want to live. They want to live their best life, however they interpret that to be. And you have the power to help people to do that. And also you have the power to advocate amongst colleagues, because you're going to have colleagues who do not believe the same way that you do, that will not see people in the same way that you do, but you have an opportunity also to be an advocate for fair, equitable, compassionate care.
Okay, great. I think we can open it up to questions for Michelle, so I'm actually going to hand this off to her.
Don't be shy.
I have a question.
Doesn't work, just show.
It does work.
Oh.
Michelle, did you, assuming you have gone through menopause, did you have were there any challenges there in this process? I haven't heard anyone mention that piece of this and how.
It's funny that you asked that. Yes, I do think that there has been some intersectionality around being a, I guess, older, more seasoned woman in this space. And I do think that, sometimes it's hard for me to distinguish because I've struggled with it so long, but I do think that it has become a little bit harder. Even in the beginning when I had the weight loss surgery and lost it and stabilized, if I pick up a couple of pounds, I could get them off pretty quickly. That is not happening like that now. I've got to work and tweak several different things in order to make things move and to maintain this. So I think that there's a lot of work to be done around hormonal health, and yeah, I think it is that, and I think you just have to get to a point, one, that you kind of recognize that your 40, 50, 60-year-old self is not your 20, 30-year-old self. That train left. But that you can still live a healthy life, but you just might need some different tools. And those tools change, I think, with each season. I think that they do change. You'll have the basic framework, I think, but I think that some things do change. So. We must have done a good job.
So my question is regarding one of the things I found as a rate limiting factor to getting patients into bariatric surgery is the medical supervised weight loss that can be translated to 6 months. How was that process for you? What did it look like? And I see what you mentioned about
Yeah.
just what did that?
You want to know what it looked like?
What it looked like?
Okay, for me.
If there's a way around it to get people.
Well, there's a lot of advocacy, and I'm going to tell you that I have mixed feelings about how I think this should go. So I'm going to preface this. So my journey was, because I did it twice, because remember I was going to do it with the sleeve, and then I said, yeah, I want to do that. And and then it took me like a year or whatever, but I'm kind of grateful for that time, because I think that the more you know before you go into bariatric surgery, I think the better and the longer your success will be. So now there's some advocates, and I think this is delicate, there's some advocates that want to see it wiped out completely, that if you've been doing certain things that, you know, you should be able to get the bariatric surgery. I fall in the middle. I think that the conversation should go, if a Michelle shows up in your office and I have been doing all of the things, I think that we should start preparing for the surgery. But I think that rather than the check boxes that we do for insurance, because, you know, when I went for the psychological piece for mine, it was actually a friend of mine that I had worked with in the ER. So, you know, but I think that there is something to be said for requiring people to participate in lifestyle change practices while they are preparing for the surgery, because I don't think it's wise to just jump right into it, because first off, I mean, just the first, like, I'd say the first month, the psychological piece, because what you're not necessarily prepared for is that you don't really have physical hunger. That is true. The physical hunger is gone for a while, but you still have, at least I did, I still had the psychological hunger. Like, I was literally like sending pictures of chicken to people. Like, when somebody, I was texting pictures to my family going, could somebody just get me a piece of chicken? Like, I don't know, like, I'm not really hungry, but I really would like a piece of chicken. And that was all about this. It was not about, I was not physically hungry. So I feel like being able to do the work and the lifestyle change and getting some tools around, how do you manage that? You know, and I am an emotional eater. I'm not gonna sit here and say I'm not, I am. But if you take the time to learn those things about you, you can then develop the skills and the tools to do something else. So now I know, like, okay, I'm not really physically hungry, but I'm ticked off. So now it might be, I'm just gonna go to the gym. But that took a long time to get there. That's not your automatic response. So that takes some skill building, and that's why you need the help of well-qualified, you know, psychiatrists, psychologists, you know, therapists, whatever it is that you have access to, or even groups. Like, even if your insurance won't pay for it, there's a lot of groups out there, even online. You know, I used to actually run one, and as part of my business, I used to run one, and a lot of people who were preparing for bariatric surgery or who had it really, really benefited from that. In fact, some of them are asking me, will I start again? I'm like, oh God, one more thing for me to do. But, and I'm entertaining it. But my point is that have the more support that you can get around any of whatever path you take, whether it's medication, whether it's surgery, whether it's a combination, you still need the lifestyle change and you still need the support. So in my world, it's the and piece. It's not either or, it's and.